A quick video about dialysis grafts, continuing on our series on hemodialysis. So last time we talked about fistulas, which is using your own material to create something for dialysis so that the technologists and the nurses can dialyze you 3 times a week, or even you can do home dialysis. That's another option that you can talk to your nephrologist about. But anyway, so if your veins are not of good quality, then the other option is to use prosthetic material, plastic material. And that works fine. It's just not the optimal product to use, because if you can use your own material and you have good material, your own veins are good enough, then it lasts better, has less risk for infection, lasts better, less chance for clotting, works better for dialysis. Again, think of this stuff as like a circuit and it's plumbing, right? What is dialysis, the quality of hemodialysis access depend on? 3 things. One is the blood flow coming in, the arterial blood flow. The second is the blood flow going back towards the heart, the venous outflow, so-called venous outflow. And then what connects those two, either your own vein, or if the vein is not good enough, prosthetic material. So with an AV graft, or arteriovenous graft, we're using PTFE usually, which is polytetrafluoroethylene, which is a synthetic material. And so it's a connection between your artery and your vein. So you can have it in your forearm here, you can have it in your upper arm. I tend to put them up in the upper arm, so-called axillary artery to axillary vein graft, because I think you have less complications with that. But if the forearm is good enough, then that's an option. So with a forearm graft, you have an incision at your elbow crease and one here, and it's tunnel underneath your skin. It's sewn into the artery and vein here. In the upper arm, it can go from brachial to axillary vein. I tend to not do that because I think you have more Steele syndrome. I don't really have any logical proof of that. Just haven't done this for a long time. I think you tend to get more of a Steele syndrome where it takes too much blood from your hand, or axillary graft, which works great in my opinion. And so both these procedures are outpatient. You just get it done. You can go home the same day. What you can expect is bruising and swelling, which is normal after surgery. Things to look out for, okay? Infection, redness, drainage, pus drainage. You're going to tend to swell with these procedures. You're going to tend to bruise. But a lot of redness, that's kind of a red flag. Drainage, fever, chills. So those are the things to look out for. In terms of pain, I think the graft procedure hurts more than the vein procedure, only because you're tunneling something underneath your skin. These are 6mm tubes usually that you tunnel into the skin. So I think it hurts a little bit more, but quite manageable as an outpatient setting. Get it done, go home the same day, come back and see me in 2 weeks to check on it. Usually grafts are ready to use in 2 to 3 weeks, depending on the swelling and the healing power. So 2 to 3 weeks, see you back in the office. If it looks great, I'll give you the okay to use it. If it doesn't look great, I'll wait to let the swelling get better. And grafts generally are easier to feel. It shouldn't be tunneled too deep. The problem with tunneling it too deep is that you can't feel it very easily. And what you're feeling for is what's called a thrill, kind of rapid blood flow buzzing in that graft underneath your skin. So complications of a graft: infection, bleeding, hematomas, and Steele syndrome, taking too much blood from your hand. That can range from something minor, like a little bit of numbness in your fingertips, to something major, where you actually lose control of your grip, or you have a lot of pain in your fingers, you have trouble moving your fingers. That's a real severe Steele syndrome that needs to be addressed quickly. And I can't tell you how many cases of, that going to lawsuits because it's missed, or there's delay in diagnosis or delay in treatment when you start losing grip strength. That is something that needs to be addressed quickly. But if it's just mild numbness in the fingertips, you can maybe hold off on something aggressive for that. But if you lose grip strength or have a lot of finger pain, that's important to really let your surgeon know. In terms of like long-term use, sometimes these grafts work great for years. You just don't have any problems. Sometimes they clot off quickly. and then you have to redo them and reclot them. So there's different things we can talk about at a later date. But that's dialysis grafts in a nutshell. There's early stick grafts where you can use them very quickly after a day or two of healing. And I don't particularly care for those because they tend to be thicker and harder to feel. And then this sometimes very occasionally, when I started this years ago, 30 years ago, we'd put a lot of these bovine carotid grafts, which is essentially cow carotid, and it's a long carotid artery. It's nice. It's really easy to sew because it's nice and pliable, unlike the plastic grafts. The downside is that I think they just don't work quite as well. So they've kind of gone out of favor. I do use them in situations where somebody tends to get infected fairly easily. So you don't really reject these prosthetic materials. You can get infected because, like any prosthetic material, that's one of the risks of having a prosthetic material is getting infection in you. So bovine carotid alternative graft material if you use for AV grafts. I mean, they work pretty well. It's not optimal, but sometimes it's the better dialysis access because your veins are not a good enough quality. You don't want to go through a whole bunch of series of surgery on a vein fistula that's not going to develop, and then you end up at the same place with a dialysis graft. So anyway, dialysis grafts work well. Next time we'll talk about the complications of hemodialysis access, and then we'll move on to peritoneal dialysis and then kind of wrap things up.